Today we're critiquing an educational guide clarifying that AMH measures ovarian reserve quantity rather than egg quality. So let's jump right into the feedback.
Yeah, let's do it.
Let's look closely at the section discussing high and low AMH misconceptions.
Right. So the section outlining misconceptions about high and low AMH levels could be strengthened by tying the debunked myths directly to specific clinical interventions.
I mean, right now it just kind of tells readers not to panic.
Yeah, exactly. The weakness is that while it effectively explains that high AMH doesn't equal success and low AMH doesn't mean a closed door, it's just, well, too vague about the actual treatment adjustments.
Right. It leaves the patient wondering exactly how their doctor is going to pivot their treatment based on these extremes.
Exactly. So the suggestion here is to connect the high and low AMH profiles to tangible examples of modified IVF protocols. Give the reader a concrete sense of what, like, efficiency and safety actually mean in practice.
So give them a concrete example, basically. Like what?
Well, for high AMH, explicitly detail that doctors might change the trigger shot strategy.
Oh, right, to prevent ovarian hyperstimulation syndrome?
Right, exactly. And for low AMH, instead of broadly suggesting scheme efficiency, specifically mention embryo banking or accumulating eggs across multiple cycles.
Wow. Yeah, that makes those medical pivots so much clearer. But once those eggs are retrieved, the AMH number stops mattering, right? Which brings us to the real overriding factor here, age.
Yes, the crucial distinction between AMH as a quantity marker and age as a quality marker requires a dedicated structural contrast to maximize the reader's understanding.
Because right now, the reality that age dictates embryo chromosomal risk and miscarriage rates is totally buried within general paragraphs.
Yeah, that's a major weakness. It dilutes its impact completely compared to the extensive focus on the AMH metric itself.
As I understand it from the notes, though, the argument here is that age dictates quality. But does overemphasizing age risk discouraging older readers who have otherwise normal AMH levels?
That makes sense. But could the evidence also support a different conclusion? Emphasizing age actually empowers patients to act swiftly rather than resting on the false comfort of a normal AMH number?
Okay, yeah, that's a good point. So what's the suggestion for the author?
Create a direct, head-to-head comparison framing age versus AMH to set realistic expectations and clearly separate quantity pressure from quality risk.
Give me a concrete example of how that looks on the page.
Sure. Add a scenario comparing a 30-year-old with low AMH against a 40-year-old with high AMH.
Oh, I see. So you illustrate that the 30-year-old may yield fewer eggs, but they are highly viable ones.
Right, exactly. While the 40-year-old might yield many eggs but faces much higher chromosomal risks.
Because those older eggs have fragile cellular machinery, like the spindles that divide the chromosomes.
You got it. It perfectly highlights why age remains the most critical factor.
Okay, so to recap today's critique, we have two actionable suggestions. First, explicitly connecting AMH extremes to specific clinical protocol changes, like trigger shots or embryo banking.
And second, utilizing a direct age versus AMH scenario to highlight age's role in egg quality.
We invite the listener to revise their work and submit it back to the critique for further review.
Yeah, absolutely.
Because while the fuel gauge is helpful, it's the age of the engine that truly dictates the drive.